Good morning. I'm here to do my week one assignment, the elevator speech. To answer the first question, what is a nurse practitioner? Nurse practitioners are practitioners who focus on the whole person's well-being with a focus on disease prevention, health education, and also counseling. No, actually all NPs must complete a master's degree or doctoral degree. And they're licensed in all states, but some have restrictions or reduced authority and must work under physicians, depending on the state that they're in. They may practice in nursing homes, schools, colleges, health departments, hospitals. And as I mentioned, they can either practice autonomously or in collaboration with other healthcare professionals. Let's see differences between a nurse practitioner and a physician's assistant. There are several differences, but the two main differences are PAs are educated in general medicine, where NPs focus on a specialty track, and they're trained to practice medicine using the PAs, are practiced medicine using a curriculum model based on medical school education, where NPs are trained in the advanced profession of nursing. Their education pieces, PAs have a lot longer clinical rotation, and they're required to have 2,000 hours of clinical rotations, whereas NPs have a require of about 1,000 hours. And let's see, certifications. NPs do not have to recertify, but PAs recertify every 10 years through an exam. And another difference, let's see, nurse practitioners have 6 different areas of specialties that they can choose from, whereas PAs have just the one specialty certifying body, which is just for medicine. And let's see, difference between nurse practitioner and a physician. Definitely a longer education for a physician. NPs have less extensive medical education, and doctors have more limited scopes of practice. I'm sorry, the nurse practitioner has limited scope of practice. Training is much shorter. Nurse practitioners, as I had mentioned, have some states do not allow full prescriptive authority, and some do, whereas physicians have full authority to practice, prescribe, diagnose, and treat patients in all 50 states. Salaries differ greatly. NPs somewhere around 120,000 a year, according to the U.S. Bureau of Labor and Statistics, whereas physicians in specialty areas can make well over 300,000 a year. The one positive difference for NPs is that the projected growth for NPs, according again to the Bureau of Labor and Statistics, is about 40% over the next 10 years, whereas the projection of growth for physicians is 3%. So that's good for us nurse practitioners. Why don't I just become a physician? I would never want to go to school that long. And I also really don't have the desire to study just the broad scope of medicine. I really enjoy working in psychiatry. And if there was not a psychiatry and mental health track for NP, I don't even know if I would do that. Because, like I said, I really enjoy working in psychiatry, and that's where my nursing education and experience has been. And I just want to expand it. And I could never go to school that long, especially now at this stage of my life. Anyways, thank you very much and have a great weekend.